All right, today we are going to be doing the skill of sterile gloving. First, we need to do our 12 safety practices. The first thing we're going to do is verify the care/order for the client. Next, we're going to remember to perform hand hygiene before and after any patient care and when handling supplies. Next, we are going to verify and review any facility policies and procedures, and we're going to gather the supplies needed for the skill. After we've done this, we're going to make sure everything's assembled with the supplies for the skill. We're then going to review the manufacturer's recommendations for using their supplies. After we've done this, we're going to knock on the patient's door, come in and introduce ourselves, and we're going to verify the patient using 2 patient identifiers, such as name and date of birth. After we've done this, we are going to assess the overall patient. We're going to assess the patient. Once we've done that, we're going to explain the procedure to the patient, and we're going to provide the patient with privacy. Once the patient has privacy, we will then raise the bed up to about waist height or anywhere that's good for good body mechanics. After we've done that, we will perform the skill. Once the skill is over, we will put the bed back into low position, raise side rails as indicated in the patient's care plan, place the cot light into reach, and we will remember to report any abnormal findings within the patient to the nurse or the charge nurse. All right, let's go ahead and start our skill. We have our sterile dressing kit. We're going to want to make sure that everything that we use today is within date and that it's undamaged. So this is good. It's within date and not damaged. We're going to touch only 1-inch margins of the sterile field, and we will go away from us first. Let's scoot this out of the way. We'll do our sides next with 1-inch margins being touched only. Now we'll go towards us. This establishes our sterile field. Now that we have done this, we're going to take our gauze sponges. We're going to remember to open away from us. I will then go around the sterile field and I will place these on. Okay, back around the sterile field. We can discard of that. The next thing we're going to do is our sterile saline solution. We're going to assess this just like any of the other supplies to make sure it's within date and that it's not damaged. Put the label in your palm. We're going to open the lid and we're going to put it top down, not within the sterile field. Okay, the next thing that we're going to do is we're going to pour the solution on, go around the sterile field, pour the solution, go back around. Okay, we can put the lid back on, and I'm going to get some of these supplies out of the way. Okay, next we are going to open the sterile gloves away from it. We can take this out, the gloves themselves, and we can place this to the side. Okay, now we're going to open the gloves. We have a right glove and a left glove, touching only 1-inch margins on this as well. Give it a little pop. You're going to don your dominant hand first, which is my right hand, touching the cuff only and not the outside of the glove. I'm going to place this glove on. 4 fingers, not including the thumb, under this cuff. And we will don our non-dominant hand. Now that they're on, we'll keep them a shoulder length apart and above the waistline. That is sterile gloving.